All right, we are going to talk about some of the basics of giving yourself an injection, whether it's a peptide or NAD or glutathione. These are some of the foundational basics that you need to know. So to begin with, you're going to have a vial and it's probably going to have a cap on it. And that cap could either be like this, and that you would flick off in order to expose the rubber hub and draw it up. Or other vials like NAD will have a metal cap. So this guy's a little bit harder to get off. You could use your nail and flick it up. The other option is to use a butter knife or a pair of scissors, but you can see now I've got that up, and that's going to expose the rubber hub. In order to draw up the medications, you want to always sterilize the rubber hub with an alcohol wipe before you put the needle into it. And so when they've been in your refrigerator, before you get started to drop the medication, always just really clean these thoroughly in order to remove any bacteria. And those are ready to go. The other important point about drawing up medications is that you want to be very careful about not making the needle get dull. So when you draw it up, first of all, let me walk you through this little syringe. There's a cap on it, and then there's a second cap where you have the actual plunger. But back to drawing it up, I like to recommend that you have it on a flat surface and you go straight in. This allows you to do it in one puncture. Next, you invert to draw up the medication and then take the syringe out. So again, you want to make sure you have it on a flat surface. You're going in perfectly straight, one puncture, and then invert. And as you can see, as a solution is coming up in this small syringe, it should be filling the barrel. So you always want to check to make sure that it's filling the barrel. All right, so that's the basics. Now we're going to get into actually using your medication. All right, now I'm going to walk you through Sermorelin as an example of how to prepare for your injection. Sermorelin is a growth hormone secreting peptide. It's used to help enhance our body's natural growth hormone production. We take it at night. Your protocol may vary, so it's important to check in your PTP the exact instructions, but typically it could be 5, 6, or 7 nights a week, an hour and a half after you eat. The reason why is because if you have insulin in your system, it's going to interfere with the peptide's function. So first we're going to reconstitute it. It comes as a dry powder. I'm using this vial as an example. Assuming that there's a metal cap, I've flicked that off. If there's a rubber cap, you could also just easily remove that. Once you've done that, I have a solution of bacteriostatic water. This is what I'm going to put into the dry powder in order to reconstitute it. So I'm going to take my large syringe and my large needle, and I'm going to combine the two of them. So that way I can now draw up the water. First, I'm going to alcohol this top. So I'm going to go straight in, invert, and draw up. So typically you're going to do something like 9 mLs of water to reconstitute it. So I'm going to go to the mark that's a 9. I'm going to take that out. And then I'm going to inject it into the dry powder. Now this should draw the fluid in. So going in with one clean puncture. And you should see the plunger start to go in on its own. Great. So now I've injected the water, the sterile water into it, and I'm going to mix it up. So I like to circulate it for about 30 seconds, and then the dry powder should all be reconstituted into a liquid form. Now we're ready to do the injection. Once we have the reconstituted solution of our Sermorelin, I'm going to take our insulin needle. I'm going to uncap both ends, both the needle side and the plunger side. I'm going to make sure that we're sterile. So again, wiping the surface. And then I'm going to draw up the number of units. Your protocol may vary. Let me put it on a flat surface, one puncture, invert, and you may be doing something like 50 units. So I'm going to draw the 50 units here. Once I have the 50 units of the Sermorelin, I'm going to do a subcutaneous injection. So typically we're going to do that around our belly. I want to make sure that we're moving positions, so never injecting the same place over and over. And it's good to do the stomach because it's not very sensitive. So I'm going to lift up and take a piece of skin, pinch it, and inject at 45 degrees right underneath the skin, and then just press the plunger in. So that way we get the medication right where it needs to go. And I'm going to take the alcohol and just massage the area afterwards to make sure that it gets absorbed. Then you're done. If you have sensitivity in the stomach area, you could also inject to the back of your arm, in the tricep, or in the inner thigh where there's a lot of subcutaneous tissue and it's not as sensitive as well.